Good morning, everyone, and thank you for joining us today at the Center for American Progress. Our program will begin shortly. Please take this time to silence all personal devices. And on the headsets you received this morning as you entered, Channel 1 is for the program entirely in English, and Channel 2 is the program entirely in Spanish. And we ask that you do please return them after the event. After the discussion, there will be time for a brief question and answer portion. Thank you.
Good morning, everyone. My name is Nira Tandon, and I'm president of the Center for American Progress. And on behalf of CAP and our amazing partners, IPASS, the Planned Parenthood Federation for America, and the Western Hemisphere region of the International Planned Parenthood Federation, I want to welcome all of you to this critically important event. Later this week, communities in every corner of the globe will come together to celebrate International Women's Day. It is time to honor generations of activists who have fought and who continue to fight for the cause of women's equality. Since the first International Women's Day took place in 1911, this fight has taken place on many different fronts, from giving women the right to vote and to enter the workforce, to providing every girl with the chance to receive a good education, to ensuring that every woman has the ability to control her own body and her own reproductive freedom. And while this is a time to recognize all the remarkable progress we've made over the past 108 years, it is also time to renew our commitment towards standing against the forces of oppression and discrimination. Here in the United States, the urgency of achieving this mission cannot be any clearer. That is because at this moment, abortion rights in America are under an all-out attack. Between 2011 and 2018, state and local governments enacted more than 400 restrictions against a woman's right to choose. And during the first 6 weeks of 2019 alone, lawmakers have introduced another 140 examples of these laws. In fact, just last week, the Missouri House of Representatives passed what many advocates have described as one of the most restrictive abortion measures in the country. To make matters even worse, over the past 2 years, the anti-choice campaign has received unfailing support from the administration of Donald Trump. The president has tried to end federal funding for Planned Parenthood. He has instituted a global gag rule that stripped vital global health resources from hundreds of thousands of women throughout the world. He has made it his mission to punish women who seek abortion care. And he has threatened the future of Roe v. Wade by nominating Brett Kavanaugh to the Supreme Court. Given everything that is at stake, it should come as little surprise that women have led the resistance to Donald Trump. Since the start of his presidency, we have marched, volunteered, and voted in record numbers. And after the recent midterm elections, there are now more women serving in Congress than at any point in American history. Moving forward, we will have the opportunity to turn the tide against those in our country who are trying to take women's rights backwards. In recent years, our movement has spent a large part of its energy defending abortion rights across the map. But now it is time for us to go on the offensive and to escalate our efforts towards affirmatively expanding the rights for every woman in the United States, for our sisters and for our sisters throughout the globe. Fortunately, there are activists around the world who can serve as a powerful and inspiring example for women here in America. That is why today, CAP is proud to welcome a lineup of extraordinary guests who've helped the international women's movement win some truly incredible victories. These women have overturned abortion laws in Ireland. They have fought to legalize abortion in Argentina, and they have expanded access to reproductive health care and legal abortion both in Bangladesh and the Democratic Republic of Congo. We're so grateful that they could join us this morning, and we can't wait to hear about their stories and experiences and insights. Now I have the pleasure of turning the program over to Dr. Jamila Taylor, a CAP Senior Fellow and Director for Women's Health and Rights of our Women's Initiative, who will moderate our conversation. Jamila?
Good morning. Thank you all so much for being here. Before we get started with the panel, a few housekeeping items. We do have translation available for the panel today, so if you have not already, you can pick up a headset in the back there. We also have a number of materials and the full bios of the panelists, if you want to grab those before we get started as well. So, one more thing about the translation. So channel 1 is for English and channel 2 is for Spanish. So as Nira mentioned, I'm Jamila Taylor with the Center for American Progress. And today we have the pleasure of presenting an amazing panel for you all. The goal of today's event is to really hear from activists who, as Nira said, have been really key in championing the fight for abortion rights globally. We want to learn from them. We all know that currently in the domestic context, we're fighting some similar fights here. And we want to use what our colleagues can tell us today to usher in, I think, some strategies for helping women here at home as we've seen them helped in these specific countries. So let's get started. So first, next to me, we have Linda Kavanagh, who is a spokesperson for the Abortion Rights Campaign Ireland. We have Lola Guerra, who is a youth coordinator with Catholics for the Right to Decide Argentina. Dr. Shamila Nahar, who is with IPAS Bangladesh. She's a senior advisor. And then Mwadi Bukenge, who is the Chief of Development and External Relations Officer for IPAS. So to get things started, I'm going to go to Linda first. Linda, as of January 1st, 2019, people in Ireland have access to legal and free abortion care. Can you tell us about the campaign that you helped lead to repeal the 8th Amendment and legalize abortion there?
Sure. I should have brought tissues out. I have not succeeded in talking about this without crying, so bear with me. Where to start? How to do it? Abortion, the 8th Amendment was brought in 1983 it was kind of as a reaction to Roe versus Wade, and it basically it equated the life of the mother with the life of a fetus, which essentially banned abortion in Ireland. We had a litany of horrendous incidents that happened as a result of that. And there had always been a kind of fight against that, but really, I suppose the movement got very galvanized out after the death of Savita Halappanavar in 2012. People took to the streets in their thousands, and from there, the Abortion Rights Campaign was born. So in that time, we used a load of different tactics to highlight how terrible this law was and how we needed to change it. And we had always called for free, safe and legal abortion access for anyone who wants or needs one without restriction as to reason. So pretty left-wing, pretty broad access. And by doing so, having that voice out there, we always pulled the conversation. The Overton window was moved. It wasn't just about getting a small bit of access. So I should say as well that since 1983, thousands of women travelled to the UK to get abortions. It wasn't that abortions weren't happening; they were happening somewhere else. And I know that in Ireland it is the next country over, but it's actually probably what would have been easier to get abortion in Ireland than parts of America right now because of all of the clinics shutting down. So the fight for free abortion was the free part was always the contentious part, frankly. To me, I find that's kind of silly, but that was always the hard part. But we had always placed it in the context of having this two-tier abortion service, that if you had money, if you had 8,000 to 2,000 euro, which is the cost, having that in a very short space of time is impossible for some people, and then for other people they can do it. So it was always this two-tier system. If you had money, you could get abortions, which is probably similar to an awful lot of countries. And we always highlighted that. So we had made abortion a red line issue for our general election in 2015. We made sure that the voter was calling for abortion access, and we brought that. Ireland's a really small country, so literally politicians will call to your door to look for your vote. So we made sure that those politicians were hearing, we want abortion access, we want to repeal the 8th Amendment. And we just got it to the point where they couldn't refuse us anymore. So we had put a lot of effort into our regional groups. As I'm sure in the American context, you can understand how issues become an elite issue, and it's not about the farmer in the Midwest, and they don't care about that issue. And we made sure that this was coming from all around the country, that politicians everywhere were hearing about this. They couldn't ignore it. That was a huge part of our work. And we also did things like submit it to the UN. So it was high level stuff, and then it was, grassroots stuff. And in the beginning of last year, 2018, we formed, together with the National Women's Council and the Coalition to Repeal the 8th, the Together for Yes campaign, which was the official referendum campaign, which helped secure the 66.4% yes vote in May last year.
Great. Yes. So amazing. And you draw a parallel there to what we see here in the United States in terms of sort of this system of, where abortion access, particularly for those who can pay for their procedures out of pocket versus those who cannot, sort of this system of inequality even within access to abortion care. And here in the U.S., we know that this is particularly true for low-income women, women of color, those who may be a part of the trans and LGBT community. And so can you talk a little bit about whether or not you've seen similarities? One, I think in terms of populations at the margins having issues accessing abortion care, even in this new context that you're seeing, and then also just any other challenges you're seeing in terms of implementing the new change.
So, we have only had abortion access for about 60 odd days, so it's very difficult to kind of monitor who is missing out. We know that regionally, like outside of the main urban areas, access isn't as accessible. Now, we're a small country. You can travel literally the length of the country in probably about 8 hours. So that might seem kind of absurd to people from states that are 3 or 4 times larger, who people have to travel a day. But it's the fact that we all, bar one county in Ireland, voted yes. Like it was emphatic. So the fact that some counties now can't, or they have 1 or 2 doctors, is not great. We also know that a big part of what we had talked about in the fight for this was how migrants in particular were being left, were not being able to access abortion, having to leave another country when you're not a non-EU resident is difficult. You have to get 4 visas. You get a visa to leave the country, to arrive in the other country, and then to leave that country and to arrive back in Ireland. That's really difficult to do in a very tight time frame with probably no money because you're already marginalised. You may not speak English or not speak English as the first language. So we are making sure within our fight in the future that the people are not being left behind, that these barriers that, like the 3-day waiting period, which we have now, the spotty access altogether, that these things are not going to stop the marginalised. We have made it our mission so that no one gets left behind.
Great to hear. And just to also add, again, similarities here in the United States, where we know that largely women living in rural areas lack access to healthcare services. They need not only abortion, but sort of the full spectrum of comprehensive reproductive healthcare services, largely based on where they live. So thank you so much for sharing that. And now I want to transition to Lola, who is our amazing youth activist on the panel today. And Lola, last year, a bill to decriminalize abortion up to 14 weeks passed in Argentina's lower chamber and nearly passed in the Senate. What was the role of the grassroots movement for abortion rights, and how have you been a part of the movement to legalize abortion in Argentina?
Well, thank you very much. At the first time, I would like to say that English is not my first language. As you know, I speak in Spanish. So I would like to say thank you for this invitation, but it's a political decision speaking my own language because it's part of my culture. So thanks for the translation. I'm going to speak in Spanish right now. Como ustedes pueden ver, nosotros repartimos estos pañuelos verdes que en mi país son un símbolo que utilizamos tanto las mujeres jóvenes, pero las mujeres de todas las edades, y significa el derecho de las mujeres al aborto legal, seguro y gratuito. Este símbolo se lo han apropiado las mujeres, sobre todo las más jóvenes, las adolescentes, y lo llevamos a todos lados, en nuestros brazos, nuestros cuellos y en nuestras mochilas o en nuestros bolsos. Entonces es muy común verlo en el tren, en los colectivos y en las calles, como una manifestación de las mujeres argentinas y el compromiso por la libertad. Y es también un símbolo de derechos humanos porque, como ustedes saben, en Argentina tenemos una lucha muy profunda y comprometida en contra de los delitos de lesa humanidad y el terrorismo de Estado que vivimos con las dictaduras militares en Argentina. Y las madres de Plaza de Mayo usaban un pañuelo blanco, como, ¿no?, así, y nosotras tomamos ese pañuelo blanco, lo hicimos verde, y hacemos verde esa lucha por los derechos humanos y la llevamos también de manera diferente en otras partes, pero tomando también esa lucha. Y esto es símbolo para nosotras de libertad, es el símbolo no solo del derecho a decidir sobre nuestros cuerpos, sino que hoy las mujeres argentinas lo estamos tomando como el derecho y la capacidad que tenemos para tomar decisiones en nuestro cuerpo, pero también en la política, en todos los espacios en los que participamos, y eso es para nosotras este pañuelo verde, y eso simboliza el movimiento argentino. Y en particular, este es un símbolo de la campaña nacional por el derecho al aborto legal, seguro y gratuito, que, yendo a la pregunta que Yamila me hacía, es lo que hemos promovido con esta campaña. El debate por el derecho al aborto no comenzó en Argentina, como ustedes se imaginarán, el año pasado. Lleva muchísimos años de organización y hace más de 10 años que se creó la campaña nacional por el derecho al aborto legal, seguro y gratuito. Al principio éramos muy pocas y hacíamos incidencia en el Congreso, estábamos en las calles y ofrecíamos este mismo pañuelo y nadie nos lo quería recibir. Y nos tiraban bendiciones, nos hacían así. De repente el año pasado fue un boom el debate por el de aborto legal, seguro y gratuito, y la gente nos pedía y lo quería comprar. Nos pagaban por este pañuelo. Yo no lo podía creer. Y de repente se empezaron a hacer más y más pañuelos, y se acabó la tela verde en Argentina, y es cierto, tuvimos que comprar tela de otros países, y estos pañuelos los realizan en nuestro país las cooperativas de mujeres. Y de repente esta movilización, lo que ahora llamamos la ola verde, tomó las calles. Fuimos millones de jóvenes, adolescentes y mujeres de todas las edades, pero particularmente las jóvenes tomaron con mucho cariño la lucha y con mucho compromiso, y fue increíble realmente que hayamos logrado una media sanción en la Cámara de Diputados. Éramos 1 millón de mujeres ese día en la calle. Yo estuve afuera del Congreso y no puedo explicar la emoción que fue no poder caminar, no podías moverte de la cantidad de gente que había. Nos quedamos durante toda la madrugada, las más jóvenes tomando whisky, bebidas fuertes porque hacía mucho frío, había fogatas en las calles, había recitales, música, todo alrededor del Congreso estaba tomado. Para mí fue uno de los momentos más emocionantes de mi vida. Nunca creí que íbamos a lograr algo como eso, y yo sentí ya como una victoria esa situación, el que las jóvenes digan: no vamos a parar hasta tener aborto legal, seguro y gratuito. Y bueno, luego sí, fue una gran decepción, siendo 2 millones de personas afuera del Congreso cuando se debatió en la Cámara de Senadores, que nos dijeran que nos dijeran no al derecho de las mujeres a decidir, que nos dijeran que no teníamos derecho a poder decidir sobre el futuro de nuestras vidas, pero no vamos a parar hasta lograr el derecho, porque realmente lo que estamos viviendo en Argentina es una verdadera revolución, una revolución pacífica por los derechos de las mujeres y por los derechos de todos y todas.
Great, thank you so much, Lola. And to follow up on, your sort of overview of the work, Argentina is a majority Catholic country. Can you tell us a little bit about how you worked with young people, religious young people, and some of the strategies that you may have used to bring them along to the fight for abortion rights?
Bueno, yo además de estar en la campaña nacional por el derecho al aborto, soy parte de Católicas por el Derecho a Decidir. Católicas es una organización que está a nivel de Latinoamérica y el Caribe, y yo en este momento soy la coordinadora regional de esta organización que está en 12 países de nuestra región. Y nosotras somos un grupo de mujeres católicas que lo que tratamos de promover es la idea de que no es incompatible ser católica y ser feminista y defender los derechos de las mujeres. No solo que no es incompatible, sino que es una obligación cristiana. Nosotras durante el último año y durante los últimos tiempos no hemos hecho más que llevar a cabo el mensaje de Cristo, de luchar por nuestros hermanos y por nuestras hermanas, hacer lo mismo que hacía Él, escuchar a las mujeres y darles el lugar y reconocer que es por su propia fe que las mujeres se van a salvar, creyendo en nosotras mismas. Y lo que hemos hecho durante el último proceso, el último año en particular, fue llevar la voz de las mujeres católicas al Congreso, que los diputados y las diputadas escuchen, porque tenemos muchas provincias que son muy fuertemente católicas en Argentina. Y la gente en Argentina es católica, pero está a favor del derecho al aborto. Entonces le explicábamos por qué, cuáles eran los argumentos. Uno de los argumentos que utilizamos es, por ejemplo, decir que la Virgen María fue consultada para ser la Madre de Dios por el ángel Gabriel. Si la Madre de Dios fue consultada, ¿cómo no vamos a ser consultadas todas las personas y todas las mujeres que tenemos que atravesar un embarazo? Le compartimos también argumentos del derecho canónico. No sé si ustedes lo saben, pero en el derecho canónico está permitida el aborto y no es causal de excomunión en muchas más causales que incluso lo que hoy está vigente en Argentina. Es decir, que la Iglesia Católica es más permisiva con las mujeres en relación al aborto que el mismo Estado argentino. Y los diputados y diputadas se quedaban como muy sorprendidos y sorprendidas. Y también contábamos nuestras experiencias. Las mujeres católicas abortamos y lo hacemos en libertad de conciencia, ¿no? Entonces, la Iglesia no puede ir en contra de lo que nosotras sentimos, de lo que nos dicta nuestra conciencia, sino que debe respetar y debe acompañar a las mujeres. Luchamos por una Iglesia compasiva, comprensiva, que acompañe y que empodere a las mujeres. Y lo que realizamos fue, particularmente yo estuve organizando una red nacional de jóvenes por el derecho a decidir con referentes en diferentes provincias del país. Como católicas hacemos un fuerte trabajo en las provincias, ¿no? Porque en las capitales siempre hay más debate, hay más recursos, pero en las provincias es donde hay que también seguir trabajando y es donde mayor presencia de los fundamentalismos religiosos hay. Entonces, trabajamos fortaleciendo esos liderazgos y sobre todo con reuniones también interreligiosas, respetando a otras religiones y todas las personas que luchamos por los derechos humanos y que tenemos miradas progresivas desde nuestra fe con relación a los temas de salud sexual y reproductiva y los vinculados a la cuestión de género, también luchamos por la laicidad del Estado. Así que esas han sido algunas de las estrategias que nos hemos dado en un país tan católico para poder avanzar en un tema tan complejo como es el derecho al aborto.
Wow, that's amazing. I love how you all were able to, sort of use religions and some of the key foundations of your religion to use that to advocate for women, and then also to ground that in their right to abortion access. That's pretty amazing. And again, I think another key tool that we can learn from here in the United States is we know that the religious right does have such a major role in advocating against the right for a woman to have access to abortion. So that was really powerful. Thank you so much. So now I want to shift to our colleagues from IPAS. Shamila, I want to go to you. Can you tell us a little bit about the abortion rights situation in Bangladesh right now, the status of the abortion law there?
Actually, I would say we have come to a long way, but there is definite challenges. Under Bangladesh Penal Code in 1860, induced abortion is illegal. Exception is to save women's life. And ministerial regulation, it is allowed. It is a part of the National Family Planning Program in Bangladesh since 1979. And it is a procedure to bring back women's menstruation, and when women's menstruation is for a short period. And this is free. Our government facilities, especially the family facilities. And also the medicine for MR, it is also available over the counter, and women can access this from the pharmacies. So for decades, MR became normalized in our country, and along with greater use of contraceptives and increases of healthcare, this has meant that fewer women die trying to gain a pregnancy. But women still have difficulties to exercise the reproductive rights. Because in our country, Bangladeshi women, they don't have any capability to take decisions about their reproductive rights. And most of the women, they are very much dependent on their husband's decisions, and women are men are powerful, and also there is lots of stigma whenever a woman asked for the MR services. Provider asked whether you are married or not, and if any women said they are unmarried, then the provider deny to provide services. It is not in our policy, but it is the stigma among the provider, and also there is many stigma against the provider, those who are providing the MR services. They are pressurized by their colleagues and peers. So these things are happening in our country, and also Bangladesh is Muslim country, and most of the Muslim, there is some misconception about the religions, and they have some misconception regarding the religions about the reproductive health and rights.
Thank you. And I don't know if you, for those in the audience who may not know, MR stands for menstrual regulation. So yeah, I just wanted to explain that to folks who may not be familiar.
Actually, menstrual regulation, this is the misnomer of early abortion in our country. And due to policy, Bangladesh Ministry of Health and Family Welfare, there is a two directorate, and one directorate is Directorate General of Family Planning. They actually create this name. Actually, my feeling is this is white, and our country and policymaker tried to save women's life. But actually there is some sensitivity for political reason. That's why they create this name. And in our country, whenever women become pregnant till 12 weeks, that means the early trimester, but early pregnancy, up to 12 weeks, it is permitted in our country. But policymakers and government said, no, it is only the regulation of the menstruation, just come back the period, but it is not abortion. But all over the country, community and women, they know it is abortion. And also the government family planning module, there is a statement, if anyone failed by any type of contraceptive methods, then test the pregnancy, and if the pregnancy is positive, then women can do the MR. So this kind of misnomer and tricky things used by the government, and it is we understand it is for the women's life, to make them available for the women of our country.
Absolutely. And one thing that I think really stands out about the wonderful work that IPAS does is not only are they working to train providers in places where abortion is hard to access, but also doing that, centering women's rights as a key aspect of everything that they do as an organization. So speaking of the work that the organization does in terms of getting access to care for women in hard-to-reach places, can you talk a little bit about the work that you all have done with the Rohingya refugees in Bangladesh?
Actually, Rohingyas, they are coming in Bangladesh, and major influx started at the end of August 2017. And that time I was visited the Rohingya refugee camps to assess whether the MR and family planning services is needed for them, or whether we are capable to introduce their reproductive health services inside the camps, and also how we might train the providers. Because IPAS working in Bangladesh in this way, that we provide the training to the government providers, And these providers including the mid-level providers and also doctors. And before IPAS, in our country, government do not have any permission to do the MR by the mid-level providers. But we take and we get the approval from the ministry. If any mid-level providers become trained, they will provide these services. And in the Rohingya community, it is a huge influx. And within a very short period, we started our work and we got the approval from the government, and we started our activities with the government facilities and also some of the NGO facilities, those who are already working there. And for a time being, we started our work, and we thought it will not be possible to train the existing providers because withdrawal of the existing providers may hamper their services. That's why we recruited, trained mid-level providers and posted government health facilities along with the government health workers. And also we posted them in some of the NGOs. Initially we started this work among the 8 government and NGO facilities, and nowadays it expanded about 37 facilities, including the government facilities. In this way, we started work to provide the MR and family planning services among the Rohingya community. And also we provide related logistics, instrument, and medicine for the MR. Through this way, we provide the services among the Rohingya community.
Thank you so much. I love the fact that, in the international context, mid-level providers are also being trained to offer abortion. Here in the United States, that is not the situation. You have to be an OBGYN in order to provide abortion here. Although there is conversation, to think through how nurse practitioners and other mid-level providers can also be trained to offer abortion. I think that would also help us ensure that more providers are available to serve women. So can you talk a little bit more about the work that IPAS does to train mid-level providers?
Actually, IPAS working with the government, and also we have implementing partner. They are capacitated and they have the trainer, clinical trainer. And initially we advocate with the government, and initially government denied to give the approval to do MR by the mid-level providers. But in our country context, there is hard to reach area, there is the river area, and these areas doctors are not available. And in this way, we advocate with the government since 2011, 12, and 13. After in 12, government agreed, okay, you can provide training to the mid-level providers. And in our country, actually, we have nurses, we have paramedics, we have another cadre. They are the family welfare visitors. And actually, family welfare visitors, they are 16-month educational background, and they are allowed to provide the MR services. But nurses, they are 4 years course, but they do not have any permission to do the MR before IPAS. And in 2012, we got the permission to do the training to the nurses, and we started our training. But after completion of the training, whenever nurses back to their facility, the facility manager said, no, you only received the training. There is no sentence is written there. You will provide the services. So again, we do our activities and advocacy with the government. And lastly, 2014, we got the approval. Whenever any mid-level providers like nurses, they receive training and they became competent and get the certification, then they will provide the services. And with this approval letter, they go back to the facility, and then they will provide services. But still there is some challenges, because these they provide these services in the modern technology, and World Health Organization recognized technology, and some of the doctors, they do not have the knowledge about this technology. That's why some facility doctors become against to do the services by the mid-level providers. So it is a continuous process, and we trying, and since 2011 to 14, and then nowadays the situation is improved. And we also provide the training to the doctors and senior doctors to understand them, make them understand. You are supervisor, you should know these techniques. And nowadays, the medicine for the MR, that we termed ministerial regulation with medication, MRM, which is internationally termed medical abortion. And this is also very acceptable among the community and also the providers. So these things is going on along with the surgical technology, and this is happening, and we are hopeful it is good and better than our previous years.
Well, it sounds like it. I mean, it's definitely clear, from how you described, how providers, one, are working together. You're training more mid-level providers, which is helping to fill the gap. And then also, I think the other interesting piece is the relationship you have with the government there. IPAS is not going into countries and working in isolation. They are working with the government. And so I know there's some advocacy happening there too, particularly in places where abortion is restrictive. So thank you so much for that. And so now I'm going to go to Muadi, who is here on the panel representing the Democratic Republic of Congo for IPAS. And can you tell us how the law changed there in 2018?
Yes, thank you so much for organizing this panel. And to my co-panelists, I think that the previous examples have really given us a diversity of examples of how you can use advocacy to make a change in something that's so contentious at times as abortion. In DRC, abortion was illegal. So the penal code punished abortion. And the women's movement, health advocates looked for ways to use international instruments that had actually been ratified by the government to compel the government to now make abortion available. The Democratic Republic of the Congo is a signatory to the Maputo Protocol. The Maputo Protocol is an African human rights instrument which was brought into force in 2003 at the African Union. All the African countries signed on to it, and it has a provision for access to safe abortion. It also has provisions for a whole range of human rights and women's rights initiatives that women's rights advocates had not been able to pass with regards to gender-based violence, with regards to early marriage, with regards to access to education as well. So it's a very important instrument. But the challenge becomes, how do you now domesticate such an instrument? And there was a regional coalition called the Solidarity for African Women's Rights, which organized in such a way to support African nations to individually domesticate this tool. And so in Democratic Republic of Congo, where I'm from and where I've been able to partner very closely with women's rights organizations and the health sector for the past 12 years, that same strategy was seen as something that was very viable. The DRC had actually ratified the Maputo Protocol in 2008. And so since 2008, there have been these efforts to really make the abortion aspect of that particular law of reality for women in Congo. The maternal mortality rate in Congo was one of the highest in the world. Unsafe abortion accounts for about 30% of maternal mortality, and around the world, unsafe abortion accounts for maybe 8 to 10% of maternal mortality. And so there's a huge need in the Congo for the reality to change. And our office, we have an office in DRC. The IPAS staff joined with other civil society groups, with the Ministry of Gender, with the Ministry of Youth, Ministry of Planning, other sectors that had been working on this for a very long time to compel the constitutional courts to actually be able to make abortion legal. And so what we have now, as of last year, is that the Constitutional Court actually did agree that the Maputo Protocol would be immediately effective. They issued a directive in March of last year, whereby the abortion rights would be immediately effective. They sent a directive to all the judicial officers indicating that the Maputo Protocol would be implemented immediately. So this means that we can actually bypass abortion law reform and go straight from having ratified an international instrument to now being able to implement it. And so now that we can implement it, we can go straight to developing the standards and guidelines around abortion care. And that is what is happening right now. The IPAS office, working with Ministry of Gender and other civil society organizations who have been in this fight for a very long time, are working to develop the standards and guidelines such that now the providers would have the guidance to be able to implement the work. And even though the conditions for provision of unsafe abortion are limited to rape, incest, sexual assault, and also if the continued pregnancy poses a danger to the life of the woman or the fetus, it still is an opening. It's an opening, is a beginning, and so this provides a hook really for the women's rights movement, for the reproductive rights movement to really try and widen the access to safe abortion across the country. And in particular, I think you're familiar with the fact that sexual violence is quite prevalent due to armed conflict in the northeastern part of the country. And it seemed that the parliament and the constitutional court were particularly sensitive to the hundreds and thousands of women actually who had been raped, but who are forced to give birth to children born out of rape, and the stigma that they actually live with on a regular basis. And so the provision of safe abortion now allows for women who are in those categories to be able to seek the services and do so safely without being prosecuted and without the providers being prosecuted.
For that. What are some of the challenges that you all are seeing as you sort of move, which is an amazing victory, I must say, but with that, I'm sure there are challenges. You're still sort of trying to move beyond an environment that has been so restrictive, and also where, access is a huge problem. So tell us a little bit about some of the challenges you may be experiencing. I think one in terms of implementation, then also as you sort of think through the development of the guidelines.
Yes, the DRC is a huge country, and the health sector does not prioritize reproductive rights very much, and in terms of the budget also that's allocated to reproductive rights. And also the social norms also stigmatize abortion. And there's a lot of work that needs to be done, even though the law has changed. There's a lot of work that needs to be done to raise awareness about the fact that safe abortion is actually available in certain conditions. This work has to be done among various sectors. And so the IPAS office, along with civil society groups and the ministries that have been involved throughout this time, are continuing to raise awareness. They're working with journalists, they're working with community organizations, they're working with the police, they're working with journalists at every sector so that they know the actual provisions, they can actually, so that people actually know the content of the actual provisions so that the provisions can be applied as they should be applied. And so this is a long-term effort. It's a long-term effort. The standards and guidelines should be developed by spring of this year. The process has already begun. And the idea would be to make sure that the standards and guidelines cover any barriers that might exist for women that are seeking safe abortion in the case of rape and incest. We want to make sure that they don't face additional barriers when they come to the health facility. And so the process that they're undergoing now hopefully will mitigate those kinds of barriers. The other types of barriers we have to think about is that many facilities are impacted by the fact that the global gag rule is in effect. The U.S. remains the largest funder of family planning around the world, including in DRC. And so that means that if a facility receives U.S. funding, but even if they have other funding, they can't use it for abortion counseling or abortion services. And so that discussion needs to continue. The work that's really exciting is that in spite of that, the strategy to train providers is ongoing. This month, as we speak, providers are being trained in 3 provinces, the largest provinces. And so this will reach 120 providers as a pilot. And the idea is to build upon that pilot such that more provinces across the country can be adequately trained. And as Shamila indicated, in the most modern and up-to-date technologies with regards to provision of safe abortion.
Thank you. So Muadi mentioned the global gag rule, which I'm sure most of the folks here in the room are familiar with. And we know that under Trump, he reinstituted the global gag rule but made it more expansive, whereas in previous iterations it only applied to U.S. foreign assistance for family planning services, and now it's broader for all organizations that are receiving U.S. funding for global health. And so can any of you also speak to what you're seeing in terms of the impact of it on the global gag rule on the groups that you work with, or even just in your activism around these issues? We know that it's not only a provision that impacts the ability of groups to provide abortion services, but also their ability to even speak about abortion, to tell a woman where she can get safe abortion care. So can any of you, I open it to all of you to chime in on that.
We weren't like actively affected by the global gag rule, but we kind of had our own gag rule. So part of the laws around the 8th Amendment was you weren't allowed to give information about abortion. So you could only get information from very specific people about abortion. So you had to go to your doctor. And essentially the way it worked out was if you as a patient said to your doctor, I want to have an abortion, the doctor could then talk to you about it, but they couldn't bring it up. And then everyone outside of this very specific relationship, it was against the law, and people had in the 90s been arrested for it. Students broke the law. It kind of got to a point there more in the last few years where it was not politically expedient to arrest people for talking about abortions. It would create martyrs, which would create riots, so we couldn't have that. So it was there, and it has a chilling effect. And so now, so we know very well about the chilling effect of not being allowed to talk about abortion. And we're now in this position 60 odd days where it's just very different. Like you can now do so when you're talking to marginalized communities, or you're talking to any community, when you talk to school children, you can now say, yeah, this exists and this is maybe an option for you. So we're very aware of the chilling effect of and the stigma that creates.
So for the gag rule in Ireland, can you share a little bit more about when it was put into place and what the vehicle for that was? Like, for instance, in the domestic context, the global gag rule put in place by the U.S. government is by executive action. So it's something that's put into place by the president as opposed to legislation, which is done by our lawmakers. So could you share a little bit more about the situation in Ireland?
Yeah, I'm absolutely drawing a blank as to how it came into effect, but we know that there had been efforts from anti-choice people, even in the 90s and even in the 2000s, I think, to try and stop so that people couldn't get information. So part of a referendum in 2004, there was really grim, as I was saying, really grim cases. There was a 14-year-old that was raped by her neighbour, and her father went to the police and said, if she goes to get an abortion, can we use the DNA to prove that she was raped? And the police it went all the way up to the Attorney General, and the Attorney General said, no, you can't leave the country to get an abortion. So they were literally stopping a 14-year-old rape victim in the 90s from leaving the country to get an abortion. And there was referendums around access then, whether if you were if suicide was imminent for somebody, they then get an abortion, because she became suicidal as a 14-year-old rape victim, and the country you're allowed to get abortion if you are suicidal, but it never really came into effect until after Savita died. But they had also tried to kind of, you weren't allowed to give information, and the country did agree to, went to referendum in the 90s and in the 2000s to allow people to get information. So, if anti-choice people had got their way, you weren't even allowed to talk about it. So it was kind of brought in, they had tried to kind of tighten the rules around information, but the Irish people wouldn't allow that to happen and had gone to referendum. But it's a very frustrating thing in Ireland, because it was a constitutional amendment. Any change has to then go to a referendum. So you're having to talk about your rights and talk about all this stuff and literally go door to door and beg for your rights, every decade nearly. So
Any other contributions in terms of, maybe in Bangladesh, that you've seen in terms of the impact of the global gag rule?
Actually, in Bangladesh, we are not receiving the US fund, IPAS, but we are interdependent. We are working with other organizations, and we are dependent sometimes the logistics and also the family planning and reproductive health commodities. And these commodities supplied by some of the organizations, and due to they receive the US government fund, they are not agree to or willing to supply or do a MOU, memorandum with IPAS as they receive the US government fund. So this way we are hampered, and also this thing is also very significant in case of Rohingya communities, because government they are not agree to provide the long-acting reversible contraceptives and permanent method to the Rohingya women. And after 1 year, or we are advocating since 2017 to August 2018. That time government agree, yes, we will, it is okay to provide the long-acting reversible contraceptives to the Rohingya women. But supply is the problem. So whenever we ask this supply to the other organizations, they are not agree to supply their commodities for us, because we are providing the abortion services and they receive the US government fund.
That's a clear example of, where we're seeing the global gag rule impact access to family planning services, as you mentioned, supplies, which is not abortion. So there's this spillover effect where it's not just access to abortion, but also these other critical reproductive health services.
Also, I would like to add, we are working with the Rohingya communities, and there are many organizations receiving the US government fund, and whenever we providing, offering them to receive the training from IPAS, these organizations deny to receive training from IPAS because they received the US government fund.
Thank you for that. I should also note that, the global gag rule did not start with Trump. It is a decades-old policy that has been used to play political football with women's reproductive health and rights. There's also the Helms Amendment, which some of you may know about, which is in statute And what it does is it restricts U.S. funding for abortion as a method of family planning. It's in the U.S. Foreign Assistance Act. The U.S. government has also withheld funding to UNFPA, the United Nations Population Fund. So there are so many examples that we can sort of roll off in terms of how we're exporting our bad policy on reproductive health and rights. At the same time, here in the U.S., women do not have, if they're on publicly funded health insurance, like the Medicaid program, they cannot use their health insurance to access abortion coverage in this country. So just wanted to take a moment there to sort of connect the dots on these issues, both domestically and abroad. I see folks kind of itching for questions. We do have a couple of more minutes. I do want to get a couple of other points from the panelists, and then we'll get to the audience. I did want to ask you all, if there is one thing, one sort of lesson, strategy that you can share with activists here in the U.S. who are also working pretty tirelessly to expand and protect access to abortion, what would that be? Anyone, feel free to jump in.
I think persistence and creativity. The example I gave talked about the fact that the protocol had been in existence for 15 years. And in spite of that, the movement kept pushing. And so we need to bring more voices into the women's rights movement. We need to make sure that we also share strategies among each other, that we're here representing various countries, that we're learning from each other, that we're trying out different approaches. And even within our countries, we need to make sure that we're also building coalitions. In the DRC, for example, there's a coalition called Coalition on Unplanned Pregnancy. And it was really very, very important in sort of raising the issue in the public space. And so we have to build on the work that's been done before. We have to remain vigilant. We have to be creative. We have to also provide accurate information. I think that the opponents to safe abortion and reproductive rights often share inaccurate information. So we have to make sure that we have data that is up to date, that actually talks about the reality of women's lives, and also the health impacts of not having safe abortion. We are making an emphasis on the fact that the lives that are being lost matter, and we know that when we have legal restrictions, then abortion becomes less safe. We should care about the fact that there are 25 million unsafe abortions taking place every year, 25 million. And some of those women will die, and young women will die. And this is all preventable. It's all preventable, and it's a human right. And we're trying to tie in the issue of abortion to women's agency, to women's broader women's rights and empowerment in general, so that it's also not just a siloed issue, but it's seen as a broader, it's an integral part of women's empowerment and human rights.
Anyone else?
Sí, a mí me gustaría compartir que creo que algo que fue muy valioso de la experiencia argentina es el confiar en la juventud, en las adolescentes, que sí tenemos la capacidad de hacer política y de generar transformaciones, que tenemos la capacidad de conducir procesos políticos, y que esa incorporación no tiene que ser separada de otras trayectorias. Yo creo que algo que valoro mucho fue la generosidad de compañeras que tenían una larga trayectoria de incluirnos, no solo para enseñarnos, sino para escuchar qué es lo que nosotras teníamos para aportar y nuestra mirada, y nosotras aprender, obviamente, y ese cúmulo de lo que viene de antes, de lo actual, de lo nuevo, creo que es un gran aprendizaje que hemos tenido en Argentina, y creo que no conozco otro movimiento que haya tenido la capacidad de recambio generacional como ha pasado en Argentina. Creo también que una buena experiencia que tenemos en Argentina es el trabajo con periodistas, porque nos ha ayudado muchísimo a la hora de cómo los y las periodistas comunican en relación al aborto. Antes nos pasaba que hablaban de aborto y ponían una mujer embarazada de 9 meses detrás de la imagen, y nosotras queríamos hablar de la interrupción del embarazo hasta las 14 semanas de gestación, cuando es una cosa minúscula. Y hicimos muchísimas capacitaciones, mucha incidencia, y hoy yo prendo la tele, les digo, no puedo creer que hablan con nuestros argumentos, repiten lo que nosotras queremos que se diga, y eso creo que es una experiencia muy interesante. Hemos hecho decálogos sobre cómo debe ser el tratamiento periodístico del aborto. Y hay 2 experiencias más que me parece interesante, si hay tiempo, que me gustaría compartir brevemente. Una es el trabajo articulado con abogadas de las provincias. El trabajar no solo con abogadas, sino con todos los sectores en los diferentes puntos del país, y no solo concentrar el trabajo en las capitales, porque la población vota en todo el país y los representantes y los tomadores de decisión escuchan a las personas que los votan, ¿no? Entonces el trabajo en las provincias es muy importante, y el acompañamiento de casos emblemáticos también ayuda mucho. Nosotras en Argentina tuvimos, previo al debate de la ley, el caso de Libertad para Belén, que era una mujer que estuvo presa por aborto 2 años, y ahí se movilizó toda la Argentina, logramos que la liberen y logramos que la absuelvan. Pero fue muy fuerte ese proceso. Y recientemente tenemos, por ejemplo, el caso de Lucía, que es una niña que había sido abusada sexualmente. La hicieron llegar hasta 24 semanas de gestación. Ella pidió literalmente que le saquen eso que le había puesto adentro el viejo ese, porque había sido abusada por la pareja de su abuela, y la sometieron a una cesárea. Entonces, a veces el acompañamiento legal de esos casos paradigmáticos, hace que la sociedad comprenda por qué las mujeres luchamos, que pueda entender con mensajes claros por casos específicos por qué nos duele tanto esa realidad y por qué pedimos que el aborto sea un derecho. Y con relación al tema del acceso a la salud, nosotras en Argentina vamos a seguir defendiendo la salud pública que está pagada por el Estado, que a veces eso es una diferencia con otros estados del mundo en los cuales los servicios de aborto se garantizan en el sector privado, en clínicas privadas. En Argentina nosotras hemos avanzado mucho, pero necesitamos seguir avanzando en que los abortos se garanticen en el sistema de salud público. Si nosotras tenemos una ley de aborto, pero las mujeres no pueden acceder en la salud pública, se van a seguir muriendo, y las que van a morir son las que van a la salud pública, que son las más pobres. Así que creo que esas son algunas de las estrategias que han sido exitosas en Argentina y en las que seguiremos trabajando.
Thank you, Lola. And then, Linda, I know you wanted to offer something, and then we'll go into questions.
So for us, the Abortion Rights Campaign is a relatively new organisation. We only started in 2013, but immediately we called for free, safe and legal abortion, as I was saying, and not having compromised language, not going in asking for something that you don't really believe in, was our strength, because we managed to keep the options open. Obviously that's not the same. Every country's coming from a different place, but I think in the US in particular, when you're coming from a place of access mostly, to not talk about rare abortions, to not talk about compromising what we know is right. We all know that abortion access is healthcare, it's a societal good, and we shouldn't be apologising for it. And what we did was, in doing that, we changed the language around abortion. We gave people that language to talk to their politicians and to their friends and their family about abortion in a non-stigmatised way. And we used the tools that we had. Like Ireland has a lot of social media users, and has an awful lot, like probably 99% of people have mobile phones. So we're using the tools that people had in their pocket. So we gave, we use social media a lot, like to help us. And people talk about bubbles, but our bubble was 66% of the population in the end. Like using those tools are important. Using what you have is important. And then also highlighting women's experiences as well, as Lola said. Centering women. It had been very dry conversation in previous years. It was about law and about politics, and that doesn't appeal to the average person. So making it about the experiences of women, the experiences of girls, the experience of anyone who can get pregnant. And because our laws affected wanted pregnancies, it was talking about that as well. So centering the patient, centering women was really, really important.
Thank you. Shamila, I don't know if you had anything to add. I wanted to give you the opportunity before we go to questions.
Actually, actually, it needs the political commitment also. Not only the country people. Actually, if we work with the government, and whenever we work with the government, if government give us the permission, then sustainability occur. Otherwise, only women or only men, they are also important. And in case of political commitment and also the awareness among the community and also the education and knowledge, because Moadi said abortion contribute the maternal mortality and also the morbidity. So we will have to focus to reduce these things. Otherwise, maternal mortality and morbidity will be increased.
I could talk to you all day. But I do want to, I have some anxious people in this audience that want to ask some questions. So we'll go right to it. Why don't we start here with Jill, and then we'll go to this other woman here. Thank you.
Hi, Jill Gay, What Works Association. My question for all of you is around access for to safe abortion services for adolescents. What has been achieved? Is that true for Bangladesh? Do you need parental permission, the permission of the husband? Y para Argentina, si puedes hablar un poco más sobre el caso de Lucía y qué será el impacto de eso.
Start with Bangladesh, and then we'll go to Lola.
Actually, in Bangladesh, there is no such law or policy to need the husband permission. But it is unwritten. There is no such policy to need the permission. Only the women can give the consent. It is okay for provide the services. And in our country, there is no such rule to ban the services for the young and adolescent. Actually, it is related with the marital status, and it is also the stigma of the providers. There is no such things written in our country. There is no record keeping like marital status. It's not required to provide the family to provide the abortion services. But it is the sensitive issue for the provider. They became shaky to provide the MR services or abortion services to the unmarried women and girls.
So it sounds like social norms are stipulating, you know, the involvement of the husband in the woman's decision making in terms of her reproductive health care. Lola?
Bueno, en Argentina nosotras tenemos algo en lo que hemos avanzado que yo quiero comentar porque a veces pareciera que estamos mal y no hemos logrado nada y las mujeres no accedan al aborto. El aborto en Argentina es legal en tres causales. Si la persona ha sido violada y el embarazo es producto de una violación, sí corre riesgo su vida o su salud, y esto fue ratificado por la Corte Suprema de Justicia en el año 2012. Eso no quiere decir que las mujeres accedan con tanta facilidad al aborto, y nosotras trabajamos para que sí lo puedan hacer. Hoy en Argentina existe una red nacional de profesionales de la salud por el derecho a decidir, que forman parte de esta campaña, y que tiene alrededor de 4.000 profesionales que trabajan en la salud pública y que garantizan el acceso al aborto en nuestro país. sí se realizan muchos abortos en los casos permitidos por ley. En algunos lugares tenemos más dificultades que en otros, pero se presenta mucha dificultad para acceder, sobre todo en el segundo trimestre y bueno, en el tercer trimestre mucho más complejo. La compañera me gustó que habló en español, muchas gracias. Me preguntaba sobre el tema de Lucía, el caso de Lucía. Estas niñas, madres, estas niñas que tienen que dejar de jugar para tener que vivir algo para lo que no están preparadas. Es un caso, el caso de Lucía es un caso, y ustedes se asustarían si supieran la cantidad de niñas que están pariendo en Argentina. La Argentina no ha podido bajar las tasas de embarazo adolescente. Y ese es un gran problema que estamos teniendo. Ya venimos realmente con varios casos. Yo formo parte de la Guardia de Abogadas Feministas y acompañamos a niñas y hay muchos casos que no se enteran. ¿Y por qué no salen a la luz? Porque nosotras creemos que el aborto tiene que ser un evento médico confidencial. ¿Por qué todo un país y todo el mundo tiene que estar sabiendo sobre la vida de una niña? ¿Por qué usted me pregunta por el caso de Lucía? ¿Cómo sabe su nombre? ¿Cómo sabe que se llama Lucía? ¿Sabe cómo sabe su nombre? Porque un obispo del Tucumán reveló la identidad de esa niña. Nosotras jamás revelamos la identidad de las niñas que acompañamos. No le damos información a la prensa, porque la lucha feminista, la ética feminista, implica cuidar a esas niñas y que ese aborto puedan acceder a ese aborto en secreto, respetando el secreto profesional y médico. Es su vida, es su privacidad. Pero usted lo sabe, al nombre de Lucía, porque un obispo llamó a toda la provincia a rezar y a luchar para defender al feto. Porque no le importa la vida de esa niña, no le importa el sufrimiento, no le importó que ella intentase suicidarse, que sufriera. Esa niña tuvo que ser sometida a una cesárea porque no le podían sacar la bombacha. No se la podían sacar porque había sufrido tantos abusos que tenía miedo. Imagínense lo duro que fue lo que tuvo que vivir esa niña de 11 años de Tucumán, de una provincia del norte de nuestro país. Hay muchas Lucías en nuestro país y nosotras luchamos y lo hacemos silenciosamente porque las niñas y los adolescentes tienen derecho a la confidencialidad. Y además tienen en Argentina el derecho, a partir de los 13 años, a consentir libremente su aborto sin necesidad de que sus padres lo sepan. Y esto ha sido por la última legislación que se ha modificado en el Código Civil. En Argentina, entonces, también nosotras como jóvenes estamos luchando por lo que se llama la autonomía progresiva de la voluntad. Que el Estado reconozca que las adolescentes pueden decidir sobre su propio cuerpo, firmar un consentimiento informado y que ellas deciden a quién le cuentan y a quién no de ese evento. Y eso es legal y así lo trabajamos en nuestro país. Así que, bueno, lamentamos mucho que exista esto, pero en Argentina estamos llevando una campaña que se llama Niñas, no Madres, para que el Estado empiece a escuchar y para que se empiecen a garantizar las interrupciones legales del embarazo.
Thank you so much. And then we had another question here.
Okay. I was asked to stand. Hi, I'm Elaine Zuckerman of Gender Action. Thank you all so much. Really very illuminating and helpful. So beyond the global gag rule, my question is about other foreign aid. Particularly, I'd like to know if other bilateral or multilateral donors help or hinder abortion rights in your country. And by way of example, very quickly, a few years ago, my organization, Gender Action, analyzed World Bank and African Development Bank projects in Africa that related to affected to reproductive rights, including abortion. And we found in some occasions their so-called assistance had conditions such as requiring user fees for accessing health services, including reproductive health. So I was wondering, what's your opinion, speakers, on in your countries that you're looking at the extent to which other foreign aid besides the global gag rule helps or hinders your achievement of abortion rights? Thank you.
Why do you want to take that one?
If I can just give an example of a reaction in Europe when the global gag rule was reinstated, is that European countries actually came to the fore and said, you know, we're going to actually increase our commitment to reproductive rights and abortion rights in particular. And so I think there are some governments that have been open, that have been wanting to step in and make sure that these services continue to be offered around the world. And I would add that we have an opportunity, because IPAS works with governments, we have an opportunity as we are developing guidelines, as we are doing with the Democratic Republic of the Congo, we have an opportunity to actually learn from all of the challenges and the kinds of realities that have been presented with regards to barriers that women and girls face when they go to access services. And we have an opportunity to actually make those guidelines and standards as broadly as possible so that they don't exist just on paper. And so I think that partners as well as donors are actually having conversations jointly to talk about the reality of access to services. So it's not just policies that exist on paper, but we're working together as a joint movement to actually see what are the issues around access. Are we making sure that access is something that women and girls are really able to exercise?
Yes, I think that's an important point. I think making the connection to the fact that rights don't always mean access. And I think, again, we're seeing that here, some similarities here in the domestic context as well. So I think we're at about time. I want to thank you all so much for being here today, you know, especially if, you know, our colleagues on the panel who have had to travel far and wide to be here today. And, you know, we want to continue to talk about these issues. We want to continue to center the conversation about access to abortion, both here in the United States and across the globe. So definitely keep in touch with us. You know, I am a part of the CAP Women's team, the Women's Initiative, so follow us on Twitter. Join our email list here at CAP. We will continue to center these issues, you know, and hope that you all will join us in the fight to secure access to abortion for everyone. Thank you all so much.